it's better now.
Okay, so you see what I'm saying is that local language here is BB. It's called BB. That came from script. So many similar words we can find, but again it's independent language. So it is a big experience of little bit this maybe the language that we really great, but it's not necessary. It's competitive. I think it is so when you get from Italy, it should be okay.
Okay, I think is there any position changes happened in your mic, or because
No, it's same position.
same position, right?
Yeah.
So I don't know why what happened. Suddenly it changes. So my voice is okay to you, right? You can hear it clearly, right?
Yeah, I can hear you.
Okay. So what happened? Because now your voice is very blurred.
Oh, is it?
Yeah.
Then maybe we can try to get connect again.
Yeah, that's what, right? So let me pause this session, and you click the link again, right?
Okay, sure.
You can end the link and you just connect again, please.
Yeah, sure. Hello.
How about now? Can you talk?
Yeah, I can hear you clearly.
Yeah, again the voice problem, man.
Oh, really?
Yeah, just I'll try this one. I'll remove you from this meeting. You just click the link again and try to join.
Okay.
Okay?
We can end the session and we can study.
Can you talk, man?
Yes.
Now perfect.
How about you?
Yeah, I think some network issues, right? Okay.
Okay, yeah.
Coming back to our question, what we had last, right? So about the language, is it really necessary to learn the local language, or English is enough to survive?
No, English is enough to survive, but it is really great. It will be really great if somebody knows the local language to get into the local people, local culture, customs, and all. But it's not necessarily need that you must know the local language.
Okay. So whenever we do the job in the hospital, is it okay if we do all the things in English, or do we, in order to interact with the co-workers and staffs?
No, yeah, actually, the thing is, most of the doctors, most of the nurses, most of the attendants are from abroad. As you know, Maldives is a small country, it's very small. The population is having around 500,000. So, as it's a tertiary level hospital and the multidisciplinary hospital, so many departments are there. There's always lack of specialized doctors, clinical nurse, paramedics, or any other healthcare profession. So mostly they are hiring from the abroad. So only way to communicate between those all these clinical stuffs is English.
Mhm. Okay. So now you are saying that you have a huge vacancies for the healthcare staffs in your place. in your hospital or in the entire Maldives, right? Why is that so? Because Maldives is a developed. What's the reason why you still have the gap?
No, actually, thing is, as I mentioned earlier, that this field is very new, right? So biomedical engineering is very new field.
Mm-hmm.
So people also, young generation, they doesn't um, uh, know much about this field and the scope and the opportunity. So now there's a government hospital, there's a health ministry, there's a private hospital. Now recently they have started one R2 hospital. That is also very big hospital, tertiary level hospital.
Mm-hmm.
So when there's a big hospital, tertiary level hospital, there will be definitely a lot of equipments, medical equipments. So in order to handle this equipment safely and using optimally, we need biomedical engineer who has experienced, I mean, who knows the device, how it works and how it functions. So that is the reason there's a vacancy for the foreign biomedical engineer here in Maldives. And from my point of view and from my understanding, there's a very less biomedical engineer in Maldives. If I'm not mistaken, only maybe 2 to 3 professional biomedical engineers who are from Maldives.
From Maldives. So that means, do you have biomedical engineering courses in the universities of Maldives?
No, we don't have.
So that's the reason why you don't have much biomedical engineers, right?
Yes, yes. Mostly now young generation, they are mostly going to India and Malaysia for the higher study, especially biomedical engineering, as
Mm-hmm.
it is locally not available. So they
And
have
they
to.
have to come back to their country to do the jobs and all.
Yes, yes.
Okay, okay, okay. So let's say a foreigner is applying for the biomedical engineering job in Maldives, and how about the how can he stay in Maldives? Like, do you provide quarters or some facilities to stay, or do they have to find out their uh, accommodations?
Okay, again, it's actually person to person varies, but when they are giving appointment letter, if it is government hospital, they will be giving you the living expenses, living allowances, then food allowances, then travel allowances also will be there.
Mm-hmm.
Then would you also will be there, other than the basic salary. So it's very, I would say from my point of view, I would say that it's very easy to adapt here as it's an Asian country. So maybe there will be small issues, those who are from Europe or USA or Canada, but mostly we are getting candidates from the Asian region,
Mm-hmm.
like Bangladesh, then Sri Lanka, India, so we can easily adapt. And the temperature is like a bit high, but after a while it should be adapted and it should be adjusted. So to come to your point, there will be a lot of private homes, houses, and also the hospital will be having their own accommodation. Most of the time, they are providing the hospital accommodation for the specialized doctors like surgeons who came from abroad. And for other staffs, other healthcare staffs, if they cannot provide the accommodation, on that case, they will be providing some living allowances, which will be more than enough to rent a place and for share basis stay here.
Okay, so that means a person he doesn't need to worry about the income uh, comparing to the expenses he may have in Maldives, right? It's
Yes,
sufficient.
in addition to their basic salary, there will be living expenses. I mean, yeah, living allowances will be there.
Okay, okay, great. Okay, man. So as you said, you are a multi-specialty hospital. So can you just give us an overall idea in the entire Maldives? So I guess Maldives is a country which has a lot of islands, right? So
Yeah.
I haven't been Maldives so far. So how many advanced hospitals you have in the entire Maldives? Can you just give me some figures and ideas how many hospitals you have?
Yeah, actually, the Maldives consists of 1,400 if I'm not mistaken, 1,270 or 50 islands.
Thousand,
So
1070.
1,270 island.
Really, man?
Yeah. Yes, it's combination of 1,200. Uh, okay, let's say 1,200 island.
Oh,
So
okay.
again, this island will be a small island. Some will be like inhabited, some are not. So like Malé is the capital city. So here, if I talk about Malé, there is a IGM is the one of the tertiary level hospital. I mean multi-specialty hospital. Other
Mm-hmm.
than this, there is private hospital. Then ADK hospital is there. Those are having like those also having multi-specialty department, multi-specialty doctors are there. And other than uh, this, there will be small clinics. Small clinics are there. And if I talk about the Hulu Malay, that is next to Malay, there also is a government hospital, semi-government I would say, uh, semi-government hospital, uh, semi-government hospital. So they also will be having most of the equipments like CT scan, MRI, ultrasonography, ECG, and all this stuff, X-ray, CRTR, all this stuff. Other than that, there will be one foreign investment hospital, that is Street Road Hospital. That is the joint investment, I would say joint venture of Malaysia and Australian government.
Mm-hmm.
That one is also state of the art hospital, multi-specialty hospitals. They are having specialized surgeon doctors from abroad.
Mm-hmm.
Those are highly skilled. But again, as it is private, it's going to be a bit expensive.
Mm-hmm.
Other than that, there's R2 city. Recently they started one hospital. That one also a multi-specialty hospital. Most of the facilities are available there. Other
Okay.
than that, most of the inhabited island, there will be small clinic and the diagnostic centers. There will be limited numbers of equipments and medical officer, and also very less staffs or clinical staffs will be there.
Mm-hmm.
So emergency cases, there is a heavy Maldives is having sea ambulance. So if it is patient is critical and they cannot provide the required support, so mostly they will be transferred to the nearby hospital. I mean, tertiary level hospital for the
Tertiary
better
level
management.
hospital.
Yeah.
Okay, okay. So how about the in technology wise, how about the hospitals? For example, your hospital. What are the advanced medical equipments you guys are dealing with? Maybe you guys are having in your hospital.
Yeah.
Any
Actually,
high-end medical equipments you guys have?
yes, as I mentioned, it's a multi-specialty hospital. So most of the like oncology is there, physiotherapy is there, radiology is there, laboratory is there, then dental is there. So we are having mostly uh, all advanced equipments like dental chairs. Those are very recently developed machines. Chair. Then if we talk about critical equipments like ventilators, we are having McQuaid ventilators, widely used, and here also we have. Then other than that, we have turbine-based ventilator is there. Then Hamilton ventilator is there.
Mm-hmm.
So those are very recent and I would say uh, recently developed equipments, which are very easy and it's very patient also very comfortable while using this device.
Mm-hmm.
So other than that, there will be a laboratory, the TLA, total laboratory automation, lot of equipments are there, and then sleep lab, like for a sleep lab also we have sleep lab devices, then CT scan, MRI, which already mentioned earlier. That portable X-ray will be there, CR will be there, DR will be there. Then ultrasonography like Pleo, then Philips, GE, those type of medical equipments also are there.
Mm-hmm. So one important question I would like to ask, apart from going out from your hospital, the Maldivian government. right? How does the government is supportive for the biomedical engineers, or especially the healthcare professionals who is coming abroad to work, do the jobs in the hospitals? Is it really supporting?
Yes, actually, I don't know other organization from IGMS. They are trying to give sponsorship for the education, especially for like facility for the local people. I mean, local who are interested in this field.
Hmm.
They are sending abroad, especially Malaysia, for this higher study. So they will be sponsoring the entire duration. I mean, the tuition fees, living accommodation, and expenses, whatever expenses are there, they will be covering. But there should be a contract. So after completing, after graduation, they have to work here for 4 to 5 years, like that. So in that case, I would say, yeah, government is trying their best to support uh, this field and to encourage young generation to study biomedical. And other than that, there will be small sessions, like conference, to let the people know that what is this field and what is the opportunity. Yeah.
Hmm. Okay. So you are also treated as a foreigner in Maldives, right? Because you are not from Maldives, right?
Yes.
Okay.
I'm also working as a contract basis.
Contract basis. So once your contract finishes, they have to renew, right?
Yes. Mostly there will be 2 years contract for the international candidates. So if the candidates perform well, and they will renew the contract.
Hmm. Okay. So as a working biomedical engineer in the hospital, what are the challenges? Because this is very important thing. What are the challenges you face in your day-to-day job?
Yeah, challenges. There will be a lot of challenges.
Yeah.
First of all, as I mentioned earlier, that we should know the basic principles of each and every equipment, but how these machines functions. So, while they are using machine, any sort of machine, let's say the X-ray machines, portable X-ray or digital X-ray or CR or PR, whatever. Okay. So nowadays mostly we are using like TR, that is digital radiography. It is based on that, like cassette is not there now, the detector is there, right? So we are exposing in the detector, so the detector automatically will be transferred. This image data will be transferred to the monitor for interpretation. So while using these equipments, there might be